in the country. There are many layers to this, and we'll try to unpeel as many of them and unpack as many of them as we can within this hour. And to help us to then be able to do that this morning, we're going to be talking, quite deeply with Boniface Durangu, who is an addiction treatment and recovery expert, and joins us in the hot seat this morning. Boniface, good morning.
Good morning, Du. Thank you for having me.
Thank you for being here.
Sana Dennis.
Dennis has given us permission until at least the 14th of February to keep saying Happy New Year.
Oh, yeah?
So it's clear that...
Valentine Badu.
It ends. When
it ends on Valentine's
Day is when it ends.
Yeah, we don't say Happy New Year again after Valentine's.
After Valentine's, you're done. Okay. You start looking for Easter. Yes.
Yeah. So as we do that, he'll tell you where the proverb is from this week.
Today we are in Angola. Not Angola, Benin. Oh my Lord. Angola was last week. So we are in Benin, eh?
Benin.
Yeah, so let's talk about the people of Benin. The capital is Porto Novo, West African country, borders Nigeria to the east, Togo to the west, Burkina Faso and Niger to the north. It is a French-speaking country, but they also speak Yoruba, Fon, Barida, and Dendi, right? And it's also the country that produces the most cotton in the continent. You know, the president just announced that the other day, and the cabinet secretary, minister for agriculture, broke down because that was his mission, and he achieved it. So accolades to the gentleman. But let's go to the proverb.
Nice.
A child who is not embraced by the village will burn it down to feel its warmth.
Oh.
How would you interpret it?
Oh, it's very appropriate even to the topic for today. A lot of times that kind of emotional pain that comes from neglect, from death of a loved one, from being generally not accepted by the community, can lead to rebellion.
Indeed. Can lead to rebellion.
Yeah.
This conversation around drugs is deeply layered, and we can think about it in different sections, whereby we look at the deal trade on drugs and how it is enriching very, very many people. And that same deal also then is plunging a lot of people into destruction. In his New Year address, just before the New Year, on New Year's Eve, President Ruto declared war on drugs, and he warned government officials who were involved in allowing this trade that he was coming for them. He went as far as to say that on cocaine and heroin dealers, let them hang, literally. He declared a national emergency in his New Year address, and he said alcohol and drug abuse is a silent but deadly threat to Kenya's health, security, economy, and social fabric. He advocated for tougher legal measures, including proposal capital punishment for hard drug dealers, heroin, cocaine, which we find has made people into zombies in many parts of this country. He said existing penalties are seen as ineffective. Government has issued warnings to officials and warned them that anybody implicated in aiding and or shielding traffickers would face prosecution and removal from office. There is to be expanded anti-narcotic enforcement, creation of new units to fight this, crackdown actions on ground, multi-agency arrests and operations, drug rehab and prevention, public and institutional responses. And why it matters now is because there is a report that came out that said 1 in 6 people aged between 15 and 65 uses current, present. What are those things we learned in school? Current, present, participle, continuous. Yes. Currently, between the age of 15 and 65 are using at least one drug. 1 in every 6 people. Ruto is framing this as a broader national crisis, not just a crime problem, linking it to security, youth futures, and socioeconomic development. And there, we're looking at a big problem. He started off the year and saying, this is what we're fighting. Are we fighting it, Boniface?
Well, I think the declaration already by itself and his focus on it is by the very nature of it very helpful. Just to bring the focus and attention at a presidential level to the issue is very helpful. Yet, it is very important to look at where other countries in the world have done and what has happened. And Kenya is a signatory to quite a bit of the fight against drug abuse and addictions, and especially the really hard ones. So in 1961, the world came together and Kenya signed this after on the World Convention on Narcotics, and that is where heroin and cocaine and methamphetamine and all these drugs were really categorized as Class A drugs, which are very classified and should not be just given like that. 1971, they added the convention on psychotropic drugs, and in 1988 another convention. So we have had 4 major conventions around the world against drugs. The same declaration is having in 2023, and Kenya is a signatory. The US and many other countries have also had this kind of fight, and you can see what happened when Trump recently took on the president of Mexico on the idea that there's a narco trade. So generally, the fight against drug abuse has a history, and it has a lot of many years have led us to believe that probably dealing with just that one side of the equation, the supply side of the equation, is not necessarily the total solution. 40 years down the line, it must be, from 1961, millions and trillions of shillings down the line. The trade has gone underground. It has increased a lot of crime, and the supply, as long as there's a corresponding demand, the supply will also find. Now, let's take back ourselves now in Kenya. We have had this narcotics and psychotropic drugs from 1994. Yeah, it has not been fully implemented because they have only dealt with the supply suppression side. There is a part of it that deals with rehabilitation, the court processes, and I'm glad the president focused on it. The court processes of following through that supply suppression, but with the support systems that come with rehabilitation and funding of treatment centers, and getting these monies and resources that are used by these drug dealers to support rehabilitation. So over the last since 1994 to we are in the year 2026. That's how many years? That's close to
22 years.
Yeah. So where has those resources gone to? We know quite a bit of. There was a time there was, I think, 10. A lot of money. Even the other day we had the Ngara lady had about 10 million in cash.
32 years, actually. 32 years,
yeah. A lot of resources around narcotics and that trade and buildings and their land of the Akina Akasha. Where is it? What has been used in the area of treatment? That is where I think the president I would really support, but I would rather we really also support the demand reduction side of it.
So what if one would ask the question, because now we're talking about 32 years of the policy in place, but one would ask the question, where has been the largest gap in the fight against use of drugs in the country? Because why are we not implementing that policy to the fullest? If at all we recognize that it is a problem, we have gotten into agreements on a global level to fight this problem. But you come at now a policy that would now guide Kenya into fighting that, and there is laxity in fully implementing it. Where is the gap?
Of course, the gap is in implementation. As in a lot of times, Kenya, we are very good at writing laws and putting things in, declaring war. But implementation is usually the problem. And also the nature of the problem. If you really look at the nature of the problem, you realize that this is not a problem that legalizing or delegalizing or making laws or locking people in prisons or whatever. It's gonna work, because it hasn't worked anywhere. You see, in 1961, if you look, my brother, you will see that one of the reasons that the convention against drugs was started is that in the World War II, there were quite a number of soldiers who left the war addicted to narcotics, because it's a painkiller. Yeah. Personally, I'm a former heroin addict. Yeah. One of the reasons I used heroin. Not one of the reasons. The day that I ever used heroin, the first time I used it was not meant to get me high. It was to deal with pain, emotional pain. I had lost somebody I love. Yeah? Somebody who had taken care of me when I'm a child. She was my auntie. And a friend of mine told me that this would make me forget. I'll feel better if I take it. His best way at mourning with me was to give me heroin. Well, I had seen it before. I had never used it before. I had never tried heroin before. But on the same day that I lost my auntie, who was like my mom now, because my mom had died long time ago, I picked it up. So what am I saying? Heroin and psychotropic drugs are prescribed even by our doctors. They are in our hospitals. Morphine is in our hospitals. Yeah. We have this used. I have met so many modern day drug addicts from opiates who have had a back problem, an injury. Some of them even serious people. I can't just name names because I've been running rehabs for a long time. That is medical. Introduced to painkillers. Some even suffering from cancer and having to use morphine and becoming addicted to morphine. Yeah. So essentially, this is not something that can be treated. I like the idea that you can supply help with the supply suppression and reduce the availability of these illegal ones, but it is in our hospitals. It's in our hospitals. Some of our doctors are abusing it. So the idea of educating is critical. Education and awareness, and that is more important than this other way. Because that other way, there's a country where somebody was lined up all the drug dealers and shot them. Where was this? I think Colombia or somewhere. Yeah.
I think so.
Yeah.
So what we're saying here is that, and it's interesting because I read a book into it was a facts into the drug cartels around the world and how they work. And one of the things that was very interesting to me is that you'll find that a very low number of folks who are selling drugs are using drugs. The ones who are enriched by this trade are not the ones who are using it, but that they prey on the dependency of others to then enrich themselves. But this is interesting because of the way that society has morphed in the last few years, decade or so, that the dependency is actually quite something. And it's this dependency that eventually leads to the addiction, if I'm correct. I'm not sure. Because, I mean, you're there to be able to tell us how that cycle actually moves. But what is coming out very clearly from a lot of people right now is that the stress that you have out here, it is not possible that you don't use some kind of drug to then be able to cope. Is that true?
Well, the pressures are a lot. Yeah. Addiction has been classified in different ways by different professionals. Number one, addiction is classified as a brain disorder. So because psychotropic drugs generally affect the brain, and the interpretation of almost everything we do is mental. Anything, any decision we make, it's from the brain. Now, psychotropic drugs and narcotics affect our perception, our thought processes, and that is where now the second group of people, and these are psychologists, seem to think that addiction is a feelings disease. Feelings disease. That's where that question of yours really is important. So, why do we use drugs? Generally, or alcohol for that matter. Yeah, it's just to change how we feel. We feel bored, we are tired, we want to celebrate, we want to, all it's feelings. We are buying feelings in a bottle, or buying feelings in a puff, or buying feelings in an injection. Yeah, shooting up just to feel feelings.
But then it goes away.
Yeah.
The feeling goes away.
Oh, yes.
And then that's why you feel you need to get it again to get back on the high, or what happens?
Now,
walk us through this, because you're, you were addicted to heroin, like you said.
Yes.
What happens? Because this is directly linked to the things that we are seeing outside here today.
Yes.
Mental health, by a task force a few years ago, declared the mental health issues as a national emergency. That what they were seeing with people like former Senator Kasanga and Dr. Frank Njenga, and going across, is that there's something wrong, and a lot of people are coping. Today's one of the headlines today: 10% of Nairobi men suffer from erectile disorder. Most participants reported cigarette smoking, cannabis use, and alcohol. There's a direct linkage to the things that we are seeing in society today. So people are walking around with a whole bunch of problems.
That's correct.
So that feeling of feeling good in the moment, the high crescendos, and then if do you need another one?
Yeah.
What happens then? After you get over it, do you need the next one? Is this what leads to the addiction?
Yes. Yes. Of course. Of course, that there are theories around both. There are some people who can use, and not majority of the people actually who use these substances. Almost close to 85% of the people do not develop a problem. You get? There are some people who generally their mind-brain chemistry has high affinity. Just naturally, high affinity for whatever substance. So you'll find people who are prone to, and you will see opiate addicts are prone to pain relief. So once they're introduced to substances that have a pain, relieve pain, they are likely to want to use it and control. It grows on itself, So it becomes dependency, because this substance is also highly addictive. Yeah? Yes, the psychoactive substances work on the brain. So the problem now becomes shifted to the drug. Yeah. But there are people who go to hospital, like some people who have argued that many people who go to hospital, they are given a shot of morphine for 2 or 3 days, and they are okay with it because it's a medical thing. It's used in a hospital setting, and they don't develop dependency. If everyone who went to hospital and was diagnosed was given morphine and developed a dependency, then we would have really, really many drug addicts. Many women, when they have labor, they are introduced to something called pethidine when they have really hard labor, and many of them do not develop a problem. So there is a theory that only a few of us, close to 15% to 10% of the people, really develop addiction. That is not to say, though, that substance used by itself has no problem. No.
Yeah, I was going to say that folks who are then, saying that you can use drugs are going to say, well, look, only 15% of people get addicted. So
No. You see, even, for example, one of my key topics around even alcohol, a lot of times we think that only alcoholics have a problem. Many people who get harmed by alcohol who are not alcoholics. Yeah? young girls in the initial stages of drinking. Many of them sometimes have ended up sleeping with people they would never have slept with, gotten diseases they would never have got, been abused or taken advantage of just because they drank 1 day or 2 days. So there's a lot that goes on even with the use of substances that are very harmful. Some of them even drink drive. Even men have been abused. So generally, it is not necessarily addiction.
Boniface, so we know it's a problem in the country. The stats is that numbers, and we see the numbers growing on a daily basis. But then question would be for us to find there is the arresting of the suppliers, making sure that supply goes down and all that. But then again, there is need for investment into rehab facilities that would help the addict bounce back. But you look at the numbers of rehab facilities, public rehab facilities in the country, and one would say zero. We don't know where they are. So then how important, or how then should the government move with speed in setting up these institutions to help those going through the problems just bounce back?
Very, very good question. Thank you very much. Even that Narcotics and Psychotropic Drugs Act of 1994 has a rehabilitation fund that our current president is really working hard to make sure that it is established. That fund brings money from all these sources. We also have the Alcohol Drinks Control Fund. The implementation is a problem. We do not lack the proper policy. We have some of the best trained minds in this issue. We have. It's just a coordination and strategic input that is really lacking. For example, recently, NACADA was investing about 1.2 billion in fixing the treatment center in Miritini. About 1.8. If you look at the expertise in about addictions, almost 95% of the experts who are trained in addictions are from the private sector. If you invested this kind of money in treating addicts in the various treatment centers across the ones that they have accredited, it would probably help more than 10 times the capacity of that one treatment center. One treatment facility. So a lot of times there has been a confusion around concrete building of treatment centers, and close to 15 of the 47 counties have done that. Even Nairobi did something at that place, at Sinai. They have built something, Nairobi County. But before they get the experts to do it, the money that has been spent on building it, they have no one who is really keen. It's also an opportunity for them to, make something for themselves and hire their relatives and friends. The private sector, way before even NACADA was set up. As I speak today, this week, last week I was celebrating 23 years clean. I come from a fellowship of people. I go to meetings, Alcoholic Anonymous meetings, Narcotics Anonymous meetings across the world. On an everyday basis, we have many meetings going on online now about Narcotics Anonymous. People who are clean for longer than myself, who have had the solutions to addictions for a long time. But this has never been really picked up on. The people who deal with, the people who end up dealing or helping structure the support system for this very specialized area are not. There are none.
They're not called on.
They have not been. They're not.
Okay.
They're not aware. They're not trained. They're not. It's a very nuanced area.
Who's not aware or not trained? Who's not aware?
Generally, the leadership.
Okay, so we're saying that with this current proclamation, because it's still brand new, it came on New Year's Eve from the president, that there was going to be now a reinforced effort to ensure that a number of things happen, that those who are in the illegal drugs trade then be brought to book, members of government officials or whomever who are aiding and abetting and or helping traffickers would also be. On the other side, he also said that prevention mechanisms would be then reinforced, because he acknowledged that these are in place, but they need, some reinforcement with treatment centers and all of this. What I'm hearing you say is that perhaps they're not consulting the right people or doing it in the right way.
Yes, I would say that. I think that we have experts. I know people who are global leaders in addictions who have never been consulted by this government. Global leaders in addiction. Yeah, I know many people who, if I were, very well trained. I have an expert who works with me, who's worked in the US for more than 15 years. Yeah, they are never consulted. They are never consulted. The president probably knows more about addictions and has picked up on this a lot more than the people who actually I've met him myself a number of times, and we've discussed addictions with him, so he's aware.
Yeah, we saw you were in a meeting that was held recently where you were in a brief.
He's aware there's something amiss, there's something that is not working out right, and this is usually the problem we have in our country. A lot of people just want jobs, get the jobs, and they're not well placed to do anything about it. So you will just have money going down the drain again, without any proper, work being done, without any smart. Recently I was watching the president launch the affordable housing thing, and I saw for a very well thought out process on how to engage young people, how to bring in engineers, social workers, into projects. That is, I think, one of our biggest problems we have. Many people, even that county government, the moment they build those rehabs, they'll employ who? Their friends. Or a councillor who will be called in to call somebody from their ward to give a job. Kazi imepatikana. Those are the sad things about our nation. Wrong people in the wrong places.
Are we therefore saying that even with the rehab facilities like what Nairobi County put in place, the biggest problem that we face as a country, because one would say we can even use facilities that we already have, the hospitals that we do have, if we want to, that our problem is engaging the right people who understand the entire nuances in dealing with this problem. That ours has turned to kazi imepatikana, other than I know you're good at these, I have looked at your credentials, I know you can deliver, and I call upon you to come help me deal with this problem. It is not a question of lack of capacity, but having our priorities misplaced in handling the problem.
Yes, I think that's a big problem in our country, and not just in our sector. I think our biggest problem is just getting the right people to do the right jobs. If you look at even that Singapore, if you listen to what that president said, that is number 2 key thing of how he got his country up, is getting the right people for the right jobs. Yeah, you cannot do if you are not meant to do the work you do now. You would not wake up this morning every day and do what you do. A lot of times you find people who are dealing with things they should not be dealing with. Misplaced resources. The human resource is one of the biggest resources we have in this world. Ours, we are number 1 at human resource. We have everything. We have the policy. We do. Yeah, ahead of the whole region in Africa. We are way ahead in Kenya in terms of, we have even an authority that deals with addictions. We have the funds to do it. We have the funds. We have alcohol drinks control fund. We have the rehabilitation fund. We can even collect all this. We have a devolved system of government. We have SHA. We have housing that is being done now by the, affordable housing that can be used to house people who are now reintegrating back to society, or a number of these houses can be used in every county to support community living of people who have mental health issues and addiction issues. But then we don't have somebody who people, and the
just say it's okay.
The moment you show willingness to do the correct thing, utakosana na watu because most of them are just there for themselves. If their houses are located to addiction, they will go to particular people. Now that is where the real problem is.
At the risk of putting words in your mouth,
Yes.
maybe you ought to say them if that's the case. So are we saying that even to fight this thing, there's no real interest in putting this thing to rest?
No, I think the president genuinely has the interest. And that's maybe why he remembered a guy like me, to be honest, and called me. He definitely. But the people around, the people who
These
zunguka
officials he
him,
was talking about.
those ones, it's the personal interests. And they usually find a way of, they find a way of discrediting, not allowing, just because they need to control.
So the people around him, there's an issue, the people around him.
Oh, yes.
So maybe I'll ask a bit of a controversial question that has been asked before. Is alcohol and drug abuse really the problem? Or is it a symptom of deeper problems that should be dealt with?
It is a symptom
because, I mean, if you're drinking because of pain, a psychological pain, perhaps we need to deal with that problem.
Yes.
If people are dealing with unemployment issues and they find a shilling, 10, 20 shillings to buy a potent drink, then perhaps we need to deal with the empowerment problem. Pain in my leg, and my doctor will say, okay, well, we can relieve the pain, but in order for us to get rid of this pain, let's solve the problem that's causing the pain. Is it an alcohol issue, or should we be dealing with those issues that are causing people, not alcohol, that are causing people to go to drugs?
No, that's the best question. This is a life issue. It's a life issue. And if I was to be the one dealing with this issue, I'll start off with education. The Ministry of Education should perhaps constitute 50% of all our efforts.
Oh, Boniface, we're trying to send kids to school, man. We can't even get that right. Sorry.
Yes, education. The Ministry of Education. And I remember you at some time, you told me I watched this program of yours for a long time. I followed. There was a time you had a professor here from Israel, and you interviewed him and you talked about the education and monitoring of behaviors and how to influence behaviors from a very early age and tracking of those behaviors as in the education system. We don't just wake up one day and we have young people overwhelming parliament. I mean, these are patterns they should have seen from a long time ago. Behavior of young people. You can watch and monitor behavior of young people. You can influence the curricula in ways that they are aware how to handle and what could happen and track. There are some countries around the world who can even track where the next crisis will come from, and it will be of what? Yeah? Yes, they can. It's science. It's just science and evidence and looking at what populations are facing what. You can tell what will happen.
I get it. I'm sorry, Dennis. I know you want to ask, but this pains me because 15 to 65, okay? 1 out of every 6 of everybody who is between 15 and 65 is on at least one drug, whether it's bangi, whether it's alcohol, whether it's cocaine.
Yes.
And this is in Kenya. We're not talking about the world. We're talking about Kenya.
Yes, 5 million people for that matter.
There you go.
Yeah.
A fifth of the population
Yes.
is on a substance, at least one.
Yes.
And this is every day.
1.3 have a problem.
So what are we talking about? We're talking about people who are going to school, high school, university. There are people who are coming to the office every day. We have seen who come to the office, they're drunk. They're not hungover, they're drunk. There are people who must have something to then be able to function because they're shaking visibly, but they're in a working environment. These are the things that the president is talking about. It's not people in the street who are hungover lying in a gutter. It's people who seem to be functional, but are dependent on this thing. And so I'm going back to that question. What is this thing that's so bad? Are families breaking apart? Are children not getting support? Is peer pressure a thing? Do people want to do experiential drugs and then get addicted? That task force that said this is a problem, perhaps these are the things I would have seen them now implementing from facility to facility, home to home.
Yes.
But there's a bigger problem. It's not the alcohol or the drug.
No, it isn't. It is not the alcohol, the drugs. That is just a symptom of the problem. heroin was there before. It's emotional pain, and I've seen it in my life, even in recovery. As I mentioned to you, the last 23 years I've been clean, but I've had moments in those 23 years that I've gone through serious emotional pain, and those are the most vulnerable moments for me. So being aware, coaching people, these are the underlying issues. Alcohol and drugs and substance use it's like just buying feelings, how to feel. You're buying your feelings. You want to change how you feel. That's a coping mechanism. So how do we coach our people? How do we develop programs around early interventions, brief interventions, low-cost rehabilitation through the community? How do we systemically develop and prevention programs? That's why you hear me when I say prevention in schools. It is the beginning of changing attitudes, developing skills. That is where the real issues are.
You see, Boniface,
Yes,
in the country today, if conversations out there, someone who's dependent on drugs, alcohol, bang, you meet them, and the first thing that the community would want to do, especially family members, is they would want to hide that problem. They don't want to talk about it. They do not want to look for help, because we also live in a society where if you heard that you're using this, the first thing that comes to our minds is you're going to be jailed. So it is a conversation that we're not having from a perspective of we are finding solutions. It is a conversation that is hush-hush among family members. They do not want to address the problem. They would rather say tutamfungia kwa nyumba, so that they do not get out to go buy the substance they're using, which then brings the conversation to how are we handling it from a home setup, from a family setup? Are we having these conversations in an open way so that everyone feels included? Because if we do not do it from our personal spaces, if we do not have these conversations in our living rooms, if we do not seek help among ourselves, it will be very difficult for even the government itself to come in and help, because we are not discussing. We'd give an example for the States. You'd find someone who's using, and the family held them together, took them to rehab, and they would say it in the public, But in Kenya, we do not. Someone who's using bang will go in the middle of a sugarcane plantation to smoke weed there. They have a problem, but that's where they will hide, But after that, we're not having these discussions. Perhaps it's a way for us to re-engineer ourselves on how we are dealing with drug and substance abuse in our home setups, in our private spaces. No?
Yes, I agree with you. It starts there. And that's why you see, I mentioned too, family, it's as a brain disease, it's a feelings disease, and now you have introduced the last component of it, it's a family disease. A lot of us who have problems, if you trace it back, and when we are doing our assessment, we start to look at it from all those angles. Where were you born? How many are you? What birth are you born? How was your childhood? And if you follow through, you will pick up the patterns. You will know where were you, even the areas where the family is based. Polygamous families, mother, single mother. We look at all those things, and you can frame up the case and assess the case, and you can see a lot of times that it's really it starts off within the family setting. Yeah. So how do we? And that's why when I mentioned that, our education system should be the cornerstone of that informs almost everything else we do. Should be a debatable information cascading all the way down. How you move to high school, what are the issues? That is how you create awareness. And unfortunately, we have an education system now that also involves parents a lot. So when you cascade it that way, you create, and what you're doing here, the media has really done their part in trying to create awareness about this problem and what it is that can be done. Yeah.
Is it too big of a problem for these structures that then are being set up by government, of course with advice from people like yourself? Is it too big of a problem for it to get granular? That this, and just like Dennis said, a lot of these problems are dealt with in secrecy. So then how do we get to the place whereby you're in my living room having a conversation with me because you've seen me sprawn somewhere? You know, how can we? It is an intimate disease. How do you get to that place whereby folks know this is where help is? A lot of the people who are in rehab today, it was not a government call. It was families who said,
Yes.
you know, this is too much.
Yes.
It was individuals who'd hit rock bottom and they said, here, there's no basement. How then do we say overall that we will not see people strewn in the streets early in the morning, that we will not see people who are clearly dealing with an issue and cannot give optimally at their workplace, or children who are suffering because of this addiction from peer pressure? How do we actually do it? Because government has said this is the year we are dealing with this thing. The president has overtly expressed his desire to say, get this thing out of the way. But how?
Systemic. You know, yes, we have also been very good at developing the problem, defining the problem, and we are good at that. We have done it. Now, what you're asking is a solution-oriented. What can we do? And that's why, you know, borrowing from what other countries are doing, borrowing from our reality, merging what currently we have, and then using, you know, as you say, deal or not deal, or deal and deal.
Deal or deal?
Deal or deal, because, you know, already, we are paying close to 6% of our GDP on losses that go through addictions.
Wow.
Yes, 6% of our GDP is a lot. Yeah, we are close to, yes, that's a lot. A lot of money lost, loss of lives, loss of our problem, even within the police force. You know, I've been around for some time, so I've even had sessions with junior police officers, and you just feel them. It's systemic. It's systemic. We have to. Rehabilitation is not hardware. Rehabilitation is software. It's systemic. We really have to change how our attitudes around, change the system, because those are the drivers of addiction, the drivers of the problem, the drivers of emotional instability. If you look at even our training of police officers, you know, sometimes it really beats me. There was a day I was almost asking those people, you know, where you guys are saying you want to invest a lot more on supply suppression. Can they even start with the police? The police stations? Drugs and alcohol and heroin find themselves in the police stations. They trade on them. All our prisons have these substances. I mean, there are people who trade on cigarettes in prisons. So I've also been a very keen person on asking our president, because, you know, even placing NACADA and the efforts on under the Interior Ministry is by itself foolhardy.
Why?
Because, I mean, this is not a policing issue. This is a systemic issue. You need a coordinating mechanism that it is not just about supply suppression. It's about prevention through education. It's about social programs, you know. It has to be somebody else. And originally, actually, NACADA was under the Office of the President. That is when Kaguthi first came into being. Yes. The Office of the President can coordinate a lot of this work, because it's an all society, all government approach. We cannot have, we cannot securitize recovery. We cannot force people into recovery. Because even, I mean, my experience now in the last 40 years show that it has not worked. Otherwise, we would not be having a declaration like the one we had the other day, isn't it? This security, I mean, how, you know, our borders are very porous. How will you survey all those borders? And by the way, by the time you delegalize anything, The process of delegalizing, humans will always find a way of getting high if they want to get high, man. They will. So how do you turn around and use other mechanism, minimize harm, educate, develop alternatives that are attractive, instead of people being attracted to substance abuse, you create a lot of potential for exercise, for fun things that people can do.
It's interesting that you say that, because oftentimes we don't realize how connected these things are. That there are folks who came out and said, you know what, you need green spaces, you need recreational centers as part of our welfare development structure mechanism. You need these spaces, because where are young people going to go out and play football, basketball, things like this? We're starting to see a mushrooming of like the football arenas and things like this around cities. We're starting to see social halls, that you would be able to put money back into social halls, because social halls a while ago were a thing where people could come together, read books and engage in activity. So even with that, that perhaps is the kind of infrastructure that should be suggested. I don't know what your thoughts are on that. And then beyond that, what would there be a danger in introducing this conversation at school age for children to know what drugs are and their harm? We know that there's in curriculum already. Would it be foolhardy, borrowing your word, to entrench it so that children grow up knowing the vices?
It is important. They know already. They know they have a phone. Majority of them these days are smarter than we are. I have a 15-year-old daughter, and the kind of things that she knows, even about, we probably don't. Some of us, they're very updated. So opening it up is good, although it has to be age appropriate. There are some levels unknown. They have been classified 9 to 14, 16 to 24. Certain knowledge and certain is cascaded. What you need to know. And the opposite is true. The opposite of this is correct. That proactive skills, pro skills, and developing ways in which kids can express themselves work better than highlighting all the time the risk factors. So an education system, or a system where we are creating those. I had a house at City Park, Nairobi, C12, and we have creative artists who sing, dance, spoken word, and at the park is a green space, and we would attract people from the park who have just come to hang around, who are probably using the park to come to our center and run programs from that center, and it was working very well. But then Sakaja thought probably this probably would do better as a bar. and it's
been turned into a bar now.
No. It has not been turned into a bar, but it is no longer with us. I know it is just hanging around, but we are closed down. That is the difference between people who are thinking in terms of green spaces for children to play, for and the ones who look at it as probably a place to make some money.
I mean, at the center of this conversation is collaboration. Citizens, those survivors or victims who are going through the same, the mentally ill, government to government collaboration, because Kenya does not produce coke, it comes from outside. So government to government collaboration in stopping our supply chain and all that. We can't really say we are handling this unless we collaborate together and mean that, because there is also talk that people in high positions in the country are into this business. So there has to also be that intention and political goodwill in addressing and fighting this. For me, it is collaboration, because unless we all are in this fight, we will move, but we'll move slow.
I agree with you. I think I allowed the efforts, I allowed the focus, I allowed the media and the focus. We just need to get some genuine action into play, Otherwise it will just be another merry-go-round. Yes. But,
Indeed.
yeah.
There's a lot of work that needs to be done. I think one would smile that at least at the very least, folks like yourself are involved in, setting up these structures that would actually be followed. Because the menace is too large, and we've not even scratched the surface on the whole other side of the illegal trade and all of this, and what is being set up to make sure that comes to an end. But that this conversation is being had is a good thing, and we want to thank you for joining us today, this morning, just to be able to open our insights a little bit more. Boniface Dirangu is an addiction treatment and recovery expert. We've been looking at fighting the menace of drugs. Deal or deal? Which one are you going to do?
Yeah.
Thank you so much for being here this morning.
Thank you.
Asante sana. Conversations continue. It's 8 a.m.